What is Dupuytren's disease? Dupuytren's disease is a condition where the tissue under the skin of the palm of the hand can tighten, causing the fingers to bend down. This is caused by straight cords of Dupuytren's disease extending from the palm to the fingers, which can often be both seen and felt. It is not a serious or harmful condition, but can cause some difficulty in using the hand in everyday activities. What is needle aponeurotomy? Needle aponeurotomy is a type of treatment for Dupuytren's disease. It involves putting a fine needle through the skin of the hand and using the sharp tip of the needle to cut through the cords of disease, allowing the fingers to straighten out. It is a good treatment where the cord of disease stands proud and is easily seen and felt, and where the patient has not had previous surgery. If the Dupuytren's disease is difficult to feel through the skin, or if there has been previous surgery in the finger or palm leading to scarring, a needle aponeurotomy may not be easily or safely performed. Your surgeon will be able to advise when needle aponeurotomy is an appropriate treatment. What are the main advantages and disadvantages of needle aponeurotomy? Needle aponeurotomy has both advantages and disadvantages over other types of treatment for Dupuytren's disease. Needle aponeurotomy allows the patient to return to normal activities much more quickly than when surgery is used to remove the disease from the hand. This is usually in the first 5 to 7 days after the procedure, compared to 6 weeks or so for after surgery. The main disadvantage of needle aponeurotomy is that the fingers may bend down again more quickly than if the disease had been surgically removed. This means that on average, half of the patients who have had a needle aponeurotomy will find that the same finger will become bent again about 2 to 3 years earlier than if they had had surgery to remove the disease. What happens in a needle aponeurotomy? If you decide to have a needle aponeurotomy, the whole process will be explained to you, including the possible complications, by your surgeon on the day of the procedure. The surgery is performed in a treatment room in the hospital and takes 20 to 30 minutes to do, depending on the number of fingers treated. The surgeon will first clean the hand with an antiseptic solution to help prevent infection. The skin where the needle aponeurotomy is going to be performed is injected with a small amount of local anaesthetic to numb it. This bit can be a little painful, but only lasts a few seconds. Then, the surgeon moves the needle through and across the cord of Dupuytren's disease, using the sharp needle tip to divide the cord. Then, the surgeon will stretch out the finger to make it straighter. Sometimes, the procedure needs to be repeated along the length of the cord in several places to get the best amount of straightening possible. The needle wounds are dressed with a sticking plaster and, after a short period of observation to be sure all is well, you will be discharged from the hospital. The surgeon may request that you wear a splint at night to keep the finger straight for about 6 months after the procedure, and this is usually fitted on the day by the hand therapist. The hand may be sore after needle aponeurotomy, and you are advised to take simple painkillers such as paracetamol and to use an ice pack on the hand during the first day after the procedure. Sometimes you can develop a small tear in the skin at the point where the needle was put in. This usually heals well, but may require a dressing for 2 weeks or so until it has healed itself. What are the possible complications of needle aponeurotomy? Needle aponeurotomy is a very safe technique when performed by appropriately trained surgeons, but complications are always possible. Firstly, it may not be possible to completely straighten the finger. This usually happens if the joints of the finger have become stiff, and it is more common if a finger has been bent for a long time. Secondly, the nerves to the finger may be accidentally damaged. If this happens, the finger may become permanently numb in some part. This may happen in up to 5% of patients. Furthermore, the finger may become sensitive to the cold and be painful in up to 10% of patients. Some patients may develop an infection after the procedure, and this is more common in patients who have diabetes. Very rarely, a patient may develop a cold, swollen and sensitive hand after treatment. This is called a complex regional pain syndrome, but only occurs in approximately 1 in 3,000 patients. All complications occur in similar numbers in both surgery to remove the disease and in needle aponeurotomy. This is an interview with a patient who's just had a needle aponeurotomy. Interestingly, he's also had surgery on the same hand many years ago, and the needle aponeurotomy was performed in a different part of the hand. You're quite unique in some respects in that you've had both the fasciectomy and the needle in the same hand. So considering the benefits of the previous operation, which lasted you 20 years, set against the time it's took you to get over that operation, and the needle, which takes you very little time to get over but doesn't last as long, which procedure do you prefer?
The needles, every time.
Why is that particularly, do you think?
Well, you get over it quickly. Invasive, well, it is invasive, but hardly. The recovery time, I say, is instantly. The results, to me, are excellent, and my hands have been bad. I'm very impressed with it. And you can have it done several times. It isn't a one-off, that's it. And as I say, recovery rate, less trauma, no scar tissue. To me, it's the way to go.
And how did you find having the needle aponeurotomy? Because it does involve putting a needle in your hand several times. Is it particularly sore, uncomfortable?
No, not really. The worst bit is anaesthetic when they put that in to start off with. It's just a prick in your hand. Well, that's the most painful bit. Once he's in there, you don't feel anything. So you do feel the needles in there. Get that right. No pain. You can feel them on the internals of your hand working away. But without any pain, it's just a strange feeling, really.
Needle aponeurotomy is a safe, reliable technique for treating Dupuytren's disease. The main disadvantage is that it will return more quickly in some patients than if they had had more extensive surgery to remove the disease. However, it has the main advantage of a speedy return to daily life with a minimally invasive procedure performed under local anaesthetic.